Imagine you're in a medical emergency. Someone calls 911. An ambulance arrives within minutes. Paramedics treat you and transport you to the hospital. Later, you receive the bill, $1,500, $2,000, sometimes even $3,000 or more, for a ride that lasted less than 20 minutes. Ambulance bills are one of the most surprising parts of healthcare costs. Many people assume ambulances are part of the public emergency system, but in many places, ambulance services operate very differently. Today, we're going to break down why ambulance rides can cost so much and how the system behind emergency transport actually works. Many people assume ambulances are part of the same system as police and fire departments. In reality, ambulance services in the United States operate under a mix of different models. Some ambulances are run by municipal fire departments or local governments. Others are operated by private companies, hospital systems, or nonprofit organizations. In many cities, private ambulance companies contract with local governments to provide emergency medical transport. These companies operate like businesses. They maintain fleets of vehicles, employ paramedics, and respond to emergency calls. But they must also cover their operating costs through billing and reimbursement. Emergency medical services operate on a readiness model. Ambulances must remain available 24 hours a day, even when they are not transporting patients. This means EMS providers must maintain staffed vehicles, trained paramedics, medical equipment, dispatch systems, and fuel and maintenance. All of these resources must be ready at a moment's notice, but unlike other transportation services, ambulances cannot predict when emergencies will occur. This creates a system where large amounts of infrastructure remain idle until needed. The cost of maintaining that readiness becomes part of ambulance pricing. One surprising part of ambulance billing is that the cost is not just for transportation. In many cases, the bill includes several different components. There is typically a base charge, which can range anywhere from $500 to over $2,000, depending on the type of ambulance. Then, there may be additional charges based on distance traveled, medical care provided, and equipment used during the transport. For example, if paramedics administer oxygen, medications, or perform cardiac monitoring, those services may appear separately on the bill. Even though the ride itself might only last 15 minutes, the bill reflects the entire emergency response service, not just the transportation. Ambulances are not simply transportation vehicles. They are mobile medical units. Paramedics and EMTs receive specialized training to handle critical emergencies. They are trained to manage cardiac arrest, stabilize trauma patients, administer medications, and monitor vital signs. Many ambulances carry advanced equipment including cardiac monitors, defibrillators, oxygen systems, and emergency medications. This equipment must be maintained, replaced, and inspected regularly. The cost of maintaining both the staff and equipment contributes significantly to ambulance service expenses. Another reason ambulance bills can be expensive is the way insurance coverage works. Ambulance providers are frequently considered out of network. This happens because many ambulance companies do not have contracts with every insurance provider. When that happens, the reimbursement paid by insurance may be lower than the billed amount. The remaining balance may be billed to the patient. This practice is sometimes referred to as balance billing. While regulations are evolving in some regions, ambulance billing remains one of the more complex areas of healthcare reimbursement. Another important detail many people don't realize is that ambulance providers often do not collect the full amount that appears on the bill. Healthcare pricing frequently works through a system of negotiated payments. Insurance companies may reimburse only a portion of the billed amount. Government programs like Medicare may pay a fixed rate, and sometimes patients are unable to pay the entire bill. Because of this, the price listed on an ambulance bill often represents the starting point of the billing process, not the final amount that is ultimately paid. This is another reason ambulance prices may appear unusually high at first glance. Government programs like Medicare and Medicaid reimburse ambulance services using fixed fee schedules. These payments often cover only part of the actual cost of providing service. To remain financially viable, ambulance providers must balance government reimbursements, private insurance payments, and uninsured patient care. Higher charges for some transports help offset lower reimbursements from other sources. This financial balancing act contributes to the pricing structure that patients eventually see. Ambulance pricing combines several complicated factors: emergency readiness, specialized medical staffing, equipment costs, insurance reimbursement rules, and government payment limits. Most patients encounter this system only during stressful medical situations. That makes ambulance bills feel particularly surprising when they arrive later. Yet, the pricing reflects the costs required to maintain a rapid emergency response system capable of saving lives. To see how this works, imagine a common situation. Someone experiences chest pain and calls 911. An ambulance arrives within minutes. Paramedics evaluate the patient, perform an ECG, administer oxygen, and transport them to the hospital. The entire event might last less than 30 minutes. But behind the scenes, the system that made that response possible includes trained paramedics on standby, emergency dispatch systems, specialized medical equipment, vehicle maintenance, and fuel, and medical supplies. All of those resources must remain available every hour of every day, even when ambulances are not responding to calls. When those costs are distributed across each emergency response, the resulting bill can be much higher than people expect. Ambulances represent one of the most critical parts of modern healthcare. They provide immediate medical care during emergencies and transport patients safely to hospitals. But maintaining that capability requires significant infrastructure, staffing, and equipment. When those costs are distributed across individual transports, the resulting bills can appear unexpectedly high. Understanding the system behind ambulance services helps explain why a short ride during a medical emergency can reveal the deeper economics of emergency healthcare.